Live from the Counterpunch Media Mobile Studios in Grand Blanc, Michigan. It's time for real lives, real families, real fitness. It's time for Derek Noel Fitness.
What is going on, everyone? Derek here with episode 37 of Derek Noel Fitness Live. Today's actually going to be a pretty good episode, especially with everything that's been going on in the world. If you're listening to this way after the fact, that's when we're recording this after Michigan has shut down a lot of things like schooling, and all hospitals and things have gone to basically necessary people only in terms of visitors. Basically keeping up with everything going on with COVID-19. So if you're watching this in the future or listening to this in the future, for context, that's what's going on. For those watching live, yeah, we're going to be talking about basically everything that you can be doing to keep yourself healthy and fit if you're not, or if you're fully complying and basically staying at home as much as humanly possible, especially if you have kids and they're staying home for the next 3 weeks or until, what is it, April 6th or something like that, at least. So this is going to be a really good episode full of information for people to be able to just go through everything. And I'm just going to reiterate, in case you've been living under a rock the past week or two, and what the actual guidelines are for what you should be doing, and then some things for what shouldn't be doing and some myths. And then we'll go into what you can actually do if you aren't able to make it into a gym due to closings or anything like that. I am actually not going to be taking calls on this episode today either, so don't worry about that. Just in the future, if you'd like to, that will be an option. Again, just for today's episode, I'd like to just get some information out and basically make this as effective as possible with as few distractions as possible. But that being said, I am also one who digresses, and if you have any comments, feel free to leave them on the thread if you're watching on Facebook or even on YouTube. And then we can have a great conversation as well. If you have any knowledge, I know a couple nurses watch this, and I actually had one nurse specifically reach out and ask me to put a little aside in for some information regarding hospitals and things going on there. So I will be making sure that I touch on that. And of course, if you have any other questions, you can always drop them in the thread as well to make sure that I see them. I'll be looking down whenever I look down. If you're watching, that's usually me checking the feed. That way I can see if anything's going on. If you know anybody, which I know basically everybody has somebody that is probably going to benefit from watching this episode today, make sure you give it a share, give it a like, start a watch party, text it to a friend, send them to it, however you need to send it to them. Send a screenshot, go, this guy, watch this guy, and that will really help out. The more views that we get, the more people that this helps. And again, this is going to be an episode that's really all-encompassing of everybody, regardless of whatever politics are or anything like that. So I guess to start out with, let's go over some of the general health guidelines. I'm not going to go into what exactly it is, because reading this or watching this later on, this is basically at a pandemic level right now. It is an international thing. Italy's on lockdown. The United States is starting to move closer towards that as the days go on. The past week has been wild. Sports are canceled. Like, everything is canceled, basically. St. Patrick's Day is 2 days from now, and that's basically canceled. And actually, last night, or today, Ohio and Illinois both said that all restaurants and bars need to be closed starting, I believe, tomorrow. So things are getting a little bit more extreme in terms of these guidelines. But what can you do as an individual to make sure that you are doing your part? And again, there are people, from the crazy people who are buying toilet paper to fight a viral pneumonia thing, because that's basically what it is a viral pneumonia, which is why it is very much so not good for people who have previous health complications, or pre-existing ones, I should say. So general health guidelines, what can you do as a healthy person? Hi, I'm Derek. This is what I'm trying to do in order to keep everyone as safe as possible. Number one is social distancing, which I think people are exaggerating that a little bit. Not necessarily exaggerating it, because you really do want to be staying at home as much as you can and not be going out into big social gatherings or into a ton of places in public. The general guideline there is you want to be able to stay 3 feet away from people at all times. I think I've seen a couple guidelines of 3 meters, which is just about 10 feet. A little bit, my math might be a little bit off there, but you know. So just making sure you're keeping a proper distance between people, especially if you don't live with them, or if you do live with them and they're an elderly person, you want to make sure that you keep a little bit more distance, because this is mainly affecting people over the age of 60 in terms of mortality rates and things like that. People over the age of 60 are who we're actually trying to look out for by doing these things. Number 2, which I never, ever in a million years thought needed to be reiterated, is wash your hands. There are tons of studies showing that just doing something as simple as washing your hands for 20 seconds at a time, probably about 2 to 3 times more than the average, or than you're supposed to. So I know at some restaurants that are still open, some bakeries, they're giving reminders of every 30 minutes to wash your hands. Just make sure you're washing your hands. There are a lot of studies that show that that really cuts down on the spread of disease just by doing that. That's really, really good. Also, cover your mouths, not with your hands, because that means you're going to have to wash your hands immediately, but cover your mouths when you're sneezing or coughing. The general guideline is to go into your upper sleeve and kind of block yourself off there. But again, just to be safe, you want to wash your hands. Don't re-wear clothing, especially if you have a sneeze or a cough. Make sure you're doing that. Make sure you are cycling through your clothes. Don't re-wear things twice in one day because, oh, I only wore it for 30 minutes. Just if you wear it, just throw it in the washer. Better safe than sorry. Don't touch your face. This is one that's going to be, that I don't think anyone realizes is as difficult as it is until you actually try to not do it. I'm pretty sure I've probably touched my face once since I've started this video. Luckily, even though this backdrop is at the gym, I'm at home. There's literally a couch behind this green screen right now. So I'm doing what I can. If you need to, putting your hands in your pockets is a great way to not touch your face. And that avoids just spreading germs even more. And of course, I already kind of touched on this with the social distancing, but avoiding large gatherings. Some of the instances, I know Florida has banned all gathering, or the Florida state governor banned all gatherings like over 250 people or something like that, and that's even going down lower and lower to just help prevent the spread of this. I'm not really going to go into what's going on in Italy versus here, but just make sure you're doing your part. Doing these things will help ensure that as few people as possible will spread this virus. And again, that's the point. It's not necessarily me. I'm not worried about myself at all. I'm worried about the people around me who are more likely to come down with this and have this be a serious thing. Because for me, I would probably live through this just fine. Yeah, I would probably be miserable for a day or 2 or 3 or 4 or whatever it is. But with my immune system and my body, I'm healthy enough that this is really not going to affect me so much. But there are a lot of people, for every person like me, there is, especially here in America, where we start to have another aging population, not everyone, for every person like me who will, there is another person who is more likely to be more affected by this, and that's what we're doing. It's kind of like the herd immunization. Well, if you don't have a herd, you don't got to worry about it. So keep that in mind. Now let's talk about a few myths, because these myths have been everything from like, maybe that might actually work to that's kind of ridiculous. So dispelling myth number 1, you don't need to buy 90 rolls of toilet paper, because everyone is apparently buying that. I've even seen a couple pictures of, hey, we're in South Korea, we have this too, and we have toilet paper. As soon as they announced this and announced that there was like states of emergency, people went insane and started buying out everything. You don't need that. I don't know anyone who's going to go through 90 rolls of toilet paper in a month. If you are, you're probably going to need a different health issue checked out than this. You probably have something else going on. So when you're going out to buy things, please just make sure that you're buying only what you need, because again, other people are going to need it. Just don't be selfish, especially when it comes to things like baby wipes. If you're buying baby wipes because you can't buy toilet paper, 2 things. Number 1, there are going to be new parents who need those, who can't find them because you were buying all of the baby wipes. And number two, baby wipes are not flushable. You need to throw them away and not throw them in the toilet. So good luck with that when it comes to sewage problems. The second thing that I saw, which kind of makes sense on paper, it claims that if you can breathe in and hold your breath, or take a nice deep breath in and hold your breath for 10 seconds, then that means that you do not have it, because it's a virus that affects your respiratory system or your lungs. As convenient as that would be for a test, if it were that simple, I feel like we would be over this a lot faster. It's just not true. So make sure that you're not falling prey to this. I've even seen on Facebook this giant text thread. I read through it just shaking my head the entire time because people are spreading it. But fun fact, if you see these things on Facebook or you see just blatantly false information, you can report it as misleading or as false information, and it will get taken down. So make sure, especially with everything going on and people still being crazy and people still shaking their head and thinking this whole thing is a hoax, just make sure you're doing your part on social media too, because that's part of the reason why this whole thing has blown up. It should be a big deal, but it's really blown up and people are going into mass hysteria over this whole thing. And that's what we do not want to happen. See, I almost touched my face there. I'm doing a really good job at trying to not touch my face. The other thing is, well, the virus will get stuck in your mouth, and it won't go anywhere for a little bit. So if I drink water, then it'll wash down. If that were the case, the common cold would you would just be able to drink a glass of water and the common cold would go away. That's just blatantly not true. Along those lines too, things like gargling salt water or vinegar. I don't know anyone who has ever tried to gargle vinegar before. I feel like that would probably do more damage to your throat than a regular sore throat would, because vinegar is very acidic and it doesn't taste very good by itself, and it does absolutely nothing to stop it. So whenever you see these things, please make sure that you report them or you comment on them saying like, hey, you might want to do a little bit more research. These things don't actually exist. And along with that, this whole thing of it being a hoax, if you have anyone in the hospital, if you happen to have anyone in the hospital, please make sure that you kind of stay away from them. And please do not take it out on the nurses and healthcare professionals who are taking care of them. Their job is to keep them alive, and as much as it might hurt you to not be there, you might also be the worst thing that could possibly happen to them if you walk in and you unknowingly pass it along, because that's basically what it is. If you go in and you touch them and they're already compromised or they're already going through a hard time, and then you decide to go through those things, you're spreading it to the people who already are in the hospital. They already have it pretty poor off, and you're not giving them a fighting chance. So please, if a nurse tells you that you're not allowed to visit whatever family member it is, please do not lose your temper with them. Please be understanding and go home. It's probably the best thing you could possibly do, and they will let you know if you need to be there for them. So just keep that in mind. It's not the healthcare professional's fault. And if you're really angry about schools being canceled, because I'm fairly certain it's coming to the point where basically every single school or every single K through 12 school in the country is going to be not suspended, but like basically like a 3-week break or so at least. It's not the teacher's fault either that you have to stay home with your kids. Yes, it's an unfortunate situation, but everyone is doing everything they can in order to mitigate these things. So keep that in mind when we're going through all of these. Luckily though, now that we've talked about this, most healthy kids and adults will be fine. Anyone under the age of 50 has a really good chance against this. At least that's what research has been showing so far. So just basically trying to avoid the people who are at risk is going to do a really large part to keeping everybody safe. So if you are someone who's around my age or you're worried about your kids, there's really no need to worry about them so much. For us, this is going to be okay. But what can we do, especially with everything closing down? Some gyms are starting to close down. How are we going to stay healthy? How are we going to keep up on our fitness when we are going, when we're trying to go through these trying times? That is going to be the big thing. The big question is, how do we keep up on our fitness? The nice thing is there are a ton of great resources. I'm putting together a daily workout that is going to be entirely body weight that you can do at home, and I will be releasing those starting tomorrow morning. If you know me through Fit Body Bootcamp, you'll also have full access to those as well. I'm just trying to make sure that you can stay that. Plus, there are a ton of other resources. If you don't want to do my workouts, for example, there's a coach named Ben Bergeron who owns CrossFit New England. He has closed his CrossFit gym, and he also owns a company called CompTrain, which trains competitors, or which is generally a fitness routine or a fitness programming service that allows people to train for things like the CrossFit Regionals, CrossFit Games, or if you're just an athlete who has a home gym that basically those kinds of workouts. They are also releasing an at-home workout version for free, which you can find by just Googling CompTrain. Again, that's Ben Bergeron's company. I cannot recommend his programming enough. The guy really knows what he's talking about, and it is a really awesome resource. Again, I'll be posting workouts. My page is going to be super active starting tomorrow. I'm really excited for that. So keep that in mind, and make sure you share them too. If you have any friends who don't have gym access, they can do these workouts at home. Maybe get some kids involved, teach them a little bit about fitness too, and you will be well on your way. So let's talk about building a workout. So say you don't have time to be waiting on Facebook for Derek to be posting something because either he's running a little bit late or you just can't find it, or you're on the road and you just don't have access to it and you want to do something. There's a really easy way to kind of program your own workout. And remember, a workout doesn't need to be 30 minutes. It doesn't need to be an hour. You can get a really killer workout in say 4 minutes. If you're doing a Tabata circuit, and I'll go over all of these in just a second. So we have bodyweight exercises, right? You have planks, you have push-ups. We like to call them the big five. So you have plank, push-up, or plank push, a pull like a row. You have a single leg, and I'm blanking on the last one right now. But you have these different forms of exercises, and if you can incorporate all of them for a full body workout, then you are going to be fantastic. So if on Monday I decide that I want to do a bodyweight squat, okay, so I have a bodyweight squat, boom, that's going to be my lower body. I can pair that up with some push-ups. I can do some jumping jacks in there for a little bit of cardio. I can do either a row if I have something that I can pull, or if I have a pull-up bar, I can try and do that. Or if I have even if I have a towel and I have a post, I can wrap a towel around a post or a pillar and I can pull myself into it, get a nice good back workout, and I can do reverse lunges, and then I can hit a plank or some mountain climbers, and I just do those 4 or 5 things for a couple sets of 10. It's a pretty good workout. So first way you can do it is set things up by rep number. So if I do planks, I'll use a typical just bodyweight workout of squats, push-ups, pull-ups. Not everyone can do pull-ups. That's totally cool. I'm just using them as an example. So with those 3 exercises, check out all of these different things I can do with that. I have, again, these are push-ups, squats, and pull-ups. So push-ups, pull-ups, squats. I'm going to do that, the 2 Ps, and then squats, because otherwise I'm going to confuse myself right now. I have 3 exercises, and I'm going to program these. I don't know. Let's go through. I can do 4 sets of 10 on each. Boom, that's 1 workout. I can take those same 3 things. I can do a Tabata circuit on each one, which means I am going to do 8 rounds of 20 seconds of bodyweight squats with 10 seconds rest. That'll be 4 minutes. I do that for squats. My legs are smoked. I do that same thing for push-ups. My chest and my arms are smoked. And then I do that with pull-ups, if I can do that with pull-ups, or maybe a TRX row. and then my back is smoked. And before I go into any of these, let's actually take a really quick break.
You're listening to Derek Noel Fitness here on IPMNation.com/counterpunch. He'll bring the smarts. Now the sweat, well, that's up to you.
And we are back. So I was just talking about some different ways that we could program the same 3 exercises. We have push-ups, we have pull-ups, and we have squats. I can do 4 rounds of 10 reps. Call that a day. That's a nice, good workout. I can do a Tabata circuit, which is 20 seconds of work and 10 seconds of rest 8 times, which makes a 4-minute circuit. I can do that with push-ups, and then I can do that with pull-ups, and then I can do that in squats. I'm going to be smoked, and that'll be done. And by the way, that only took 12 minutes to do all of that work, and you're already done for the day. What else could we do with that? We could do a time frame training. So we can do a minute straight of each one of those 2 times, and we're done. And guess what? That can be 6 minutes. So you can manipulate the time, you can manipulate the reps. If you wanted to make that a little bit harder or a little bit more fun, you could go with a classic workout like 5 push-ups or 5 pull-ups, 10 push-ups, 15 squats. Set a 15-minute timer on that and do that as many times as you possibly can in 15 minutes. And all of a sudden we have a really awesome burner of a workout, because trust me, that does get tiring. I've done that before. It gets very tiring, but it also does a really effective job, because again, we're hitting our lower body, we're hitting our upper body, and we're hitting the back part of our body too. So we're hitting the front side and the back side of our upper body and the whole legs. Really, really awesome way to be able to knock those things out. If you have other equipment like gym, if you have a home gym or you have a few dumbbells or a treadmill, you can even incorporate some of those things. Even if you're not working out and you don't have any plans on doing any physical, like actual strenuous activity, one of the best things you can do to keep up on your calorie burn is actually go for a walk. That being said, it is March right now, and the warmest is probably going to be is about 35, 40 degrees. If that's too cold and you have a treadmill, hop on the treadmill and walk for 30 minutes. Set the incline at 1 and just walk. If you want to run it, you can, but just keeping that body moving, especially if you have an active job where you are teaching kids all day and you're on your feet all day and you're moving around and all of a sudden you're stuck cooped up at home, the best thing you can do is probably actually go for a walk or jump on the treadmill and just walk or clean. Cleaning is a really good way, and it's going to help keep everything sanitary at your house too. Help prevent the spread even more. Those are the big things. If you can go out for a run and you want to, go ahead, because again, you're keeping distance, so you're good. You don't have to quarantine yourself inside your house the entire time. And the third thing, which I think is the biggest thing, is nutrition when you have kids involved. There are some people, and I've talked to some people who have absolutely no problem keeping themselves on plan when their kids are home, and there are other people who throw their hands up in the air and just want to scream and shout, saying that they can't do it because their kids are involved. I'm here to say you can do it. There's really not that much of a change. Sure, you might have to do a little bit extra work. You're also at home a lot more than you typically are when you're working. So if you're at home, generally speaking, you're going to have time to do a little bit of extra meal prep. So you get to make your own meals. Then you can cook whatever you want for your kids. And if you're trying to say that chips are a big problem for you, and you can't not have chips in your house because your kids are there, if you know that you shouldn't be eating them, why are you letting your kids eat them? And I know it's quick, it's convenient to just give them a quick snack like potato chips. And I'm not saying don't eat potato chips, by the way, but if that's your crutch and that's your excuse for not losing weight or not keeping up on your nutrition is you have chips at home, don't have chips at home. Get them out of your house. I know for me, if there is Reese's peanut butter cups in the house, they're going to get eaten no matter what I tell myself. There's only so much my willpower can handle. So please make sure that you're getting the things that you don't need to be eating out of the house. If you don't have kids, that should be super easy. But if you do have kids and you do have those things like fruit snacks, which are delicious, by the way, or you have the potato chips that you feel like your kids need, and you know that you're going to be in the house with them for 3 weeks, and you just don't want them screaming their head off because all of a sudden you're denying them potato chips and you've given them to them, try and find some healthier options. Find some things. Usually as adults who are super picky, it's because their parents didn't make them eat things that they weren't exactly big fans of when they were little. So all these good options to be able to do that. If it's something that it's just a no-go, then work around it. Again, I'm not someone who says to straight up deprive yourself of something. And that being said, I need to deprive myself of Reese's peanut butter cups because I will not stop eating them, and I will tell myself that this is my last one as I eat like 5 more. I totally get it, guys. That's kind of how it goes sometimes. But you can also go, okay, if you have the tolerance, if it's something that you just kind of like every once in a while, if you want to eat a little bit of ice cream with your kids, eat a little bit of ice cream with your kids. Just plan around it. Maybe you eat a little bit less carbs and fats during the day to make up for the fact that you're eating ice cream at night. That's totally cool. You can totally make this happen, and you can teach your kids about some nutrition along with other things while you're home for the next 3 weeks. So keep that in mind. I'm actually going to check the thread right now to see what is going on down here. So let's see. Heidi was confirming, she's a nurse by the way, that gargling with salt water does not prevent coronavirus. Like I said. And she also said thanks for sharing that info. Of course, Nick hops in just in time to say deadlifts and gummy bears. Totally going to prevent the coronavirus by doing deadlifts and eating gummy bears. That is obviously a joke, but it is a dang good combo. Deadlifts are my favorite exercise. So if you have any questions, please make sure you drop them in the comments below. I'm going to start going through and start wrapping this up. Like I said, I wanted to just make this a really concise, informational episode. I honestly have no idea how long I've been talking for, but like I said, I'm not super concerned with timing today. I'm more concerned with making sure that this information gets out. So you can find me on Facebook at facebook.com/TheDerekNoel or on Instagram at TheDerekNoel. You can find me at those places really easily. You can also check this out on YouTube if you search Counterpunch Media, or if you even type Derek Noel Fitness Live, I believe it just should pop up as like one of the first things. You can find it that way. If you could give our YouTube channel a subscribe, just give it that nice little clicky, and that would help us out a lot as well. We're trying to grow our YouTube base. As always, if you have any questions and you don't feel comfortable asking them publicly, please shoot me a private message. I would love to be able to help you out. If you have any nutrition questions about what you should be doing for the next 3 weeks, or if you have numbers and you think that they might need to be adjusted for you being home for the next 3 weeks, shoot me a message. I can answer those kinds of things. I want to make sure that everyone stays on their fitness plans as much as they possibly can while this whole COVID-19 thing is getting taken care of. So please, please, please give this video a like and share it with your buddies. This has been a great episode. No other questions. So have a great night, everybody.